Hi, my name is Edward Heffler. I'm here for my class HCA 701, and I was assigned the topic that a single-payer system will not cure most of the ills of the healthcare industry. So, various single-payer proposals. Senator Sanders' Medicare for All is one of the recent ones. Senator Warren has a similar but different Medicare for All plan. There's a Medicare Extra for All that's been talked about. They're all similar in that everyone pays zero out of pocket and everything is free. But I'm here to tell you everything is not free. Okay, somewhere along the lines, somebody has to pay for it. Now, pretend you go to school, you have a class, the class is great, the teacher's great. At the end of the semester, the professor says, hey everyone, you guys did such a great job all year, you're such a great class, I got everyone free pizza. So now, did you get free pizza? Well, you may have gotten it, but it wasn't really free, the professor paid for it. Or possibly you go up and talk to the professor after class, you're like, this was super cool of you, and the professor says, well, look, at what actually happened was I want you to know I didn't pay for this out of pocket. We ended up with $200 extra in the department budget. We had to spend it on something, and you guys did such a great job. You really earned it. So instead of just buying some equipment we didn't really need, I got you guys a pizza. But even though I didn't pay for it out of pocket, I felt like you guys did such a great job. So in a case like that, the professor didn't pay for it, but somebody paid for it. Did the college pay for it? Well, let's think. You paid tuition, the other students paid tuition. That tuition went to the college sent it out to all the various departments. The department set the budget, and in that budget, some of that came back to you as pizza. So in essence, in a case like that, you paid for your own pizza. Or like I said, the professor paid for it, somebody paid for it, but it wasn't free. So now they talk about their budgets and their proposals. So Senator Sanders' plan estimated 2.6 to 3.2 trillion dollars per year. The 2019 U.S. budget was 4.2 trillion, and they already spent over 50% on Medicare, Medicaid, and Social Security. So the 2019 budget deficit was $1 trillion. So now his plan, you already spent all these trillions on Medicare, Medicaid, and Social Security, spent an additional 2.6 to 3.2 trillion per year out of the federal government. Your new deficit would be 3.6 to 4.2 trillion dollars per year if adequate revenues were not generated. And this is just simply not sustainable. So getting back to where does all this money come from? So as I keep saying, everyone likes free stuff. Senator Sanders said the money to pay for all this is going to come from increased taxes on corporations. It's going to come from increased taxes on the rich. They're going to track down and find hidden offshore savings that belong to the corporations and riches. Oh, and by the way, taxes may have to go up a little bit to the working class, which doesn't sound quite so free. But he says, look, people criticize, where he points the revenues are going to come from. He says, we can worry about this later. I'm just throwing options out there. We can pass the law and we can discuss what options we want as to where we're going to generate the revenues from to pay for it. We don't got to worry about that right now. Let's just pass the plan. Now, the Nonpartisan Tax Foundation evaluated the whole thing, and they said Bernie's plan will actually reduce the gross domestic product by 9.5% in the U.S., and it will reduce after-tax income for all Americans by an average of 12.8%. So that means the amount of money you take home every year is going to go down by 12.8%. It just doesn't sound very free to me anymore. And then Senator Warren, she has a similar plan. Now, she did mention $9 trillion over 10 years from employers, and this is actually probably the best revenue source that anyone listed so far. So all she wants to do is she estimates that about $900 billion a year is spent for employee health insurance by private employers. And so over a period of 10 years, that's $9 trillion. She would tax that money from the corporations that they're already spending, government would take the money from the corporations and use it towards the health care, which the employers are already paying anyways. The other thing, though, is she has a 6% wealth tax. She wants to increase corporate taxes, and she wants a $2.3 trillion over 10 years from improving tax enforcement. So my questions here are what and why? So the 6% wealth tax, what is that? So that means anyone worth $1 billion or over, they're going to take 6% of your wealth every year, and that's going to instantly turn into money, and they're going to use that towards spending. So there's a few problems here. So anyone with that kind of wealth, their money is tied up in real estate, it's tied up in the stock market. It's not readily changeable into cash. So the problem is if you say, hey, I'm going to seize some of your land to pay for this, unless you pick which land, and then you have to auction it off you're not going to get fair market value. Everyone knows the government's going to be doing this every year. It's just like a bankruptcy court. They're going to come in, they're going to lowball you because they know they can lowball you because they know the government needs dollars. They're not going to be able to pay for health care with acres of land. And the same thing happens in the stock market. The prices of stock go up when demand exceeds supply, and when supply exceeds demand, the prices of stock go down. So the problem is you see somebody's shares of stock, maybe you take Microsoft and Bill Gates and it's $150 a share, and you start selling more and more shares, you're going to drive that price of that stock down. So you're not going to get $150 a share. As the price keeps going down, you're going to get less and less money. So instead of getting an estimated $1 trillion a year from this wealth tax, you might only get 4, 5, 600 billion a year from the wealth tax, which leaves you a huge shortage every year. And then my why question is this 2.3 trillion from improving tax enforcement. So that's $230 billion a year. And my point on this is simple. If you know that we can generate $230 billion a year from improving tax enforcement, why are we waiting to enact universal health care? Show us your plan. Let's enact it. Let's find that $230 billion every year that we're not tracking down, and let's collect it. Medicare Extra for All, this so-called think tank came up with this. You can keep your employer's plan or Medicare Extra. They're saying we're not going to force everyone out of their employer's plan. As an employer, you can just enroll everyone in Medicare Extra and pay them on behalf of your employees. If the employer wants to keep their own plan, the employee can still say, well, I want Medicare Extra instead, and take the Medicare Extra over the employer's plan. And in Medicare Extra, get ready for this, everything is free. It's all free. The way it works for them, the way they're going to actually cover everything and generate revenue. So if your household income is less than 150% of the federal poverty level, it's no cost for you to get in this. And then they start charging you an income tax every year. And that income tax percentage is based on your income related to the federal poverty level. The maximum is 10% income tax if it's greater than 500% of the federal poverty level, your total household income. The problem with that is generating the income off the higher income people. So lower income people, if they have a choice of their employer or Medicare Extra, and their employer has, out-of-pocket expenses like co-payments on medications, on visiting a primary care doctor, they're going to choose Medicare Extra, and I can't blame them, because in this case, for them personally, it's free versus money out of the pocket. The other aspect there, though, is the higher income people. You don't even have to be super high income. Maybe your income's $75,000 to $100,000, a little above average. So maybe in your plan, the first $1,000 gets paid for out of pocket. Then you pay 20% up to a maximum family out of pocket of $5,000 for the year. Now, if you enroll in the Medicare Extra for All, at $75,000, you're paying $7,500 a year, or $100,000, you're paying $10,000 a year. So going back to this employer's plan, if it's a low expense year, I might only pay a few hundred for me and my family out of pocket. If it's a high expense year, I'm capped at $5,000. So any given year, I'm paying a few hundred to $5,000. Why would I want to go ahead and pay $7,500 or $10,000 a year every year, no matter what, to Medicare Extra for All? Now add in the people that make $200,000, $300,000, $400,000 a year, and ask me why any of them would not want to stick with their employer's plan. Medicare Extra for All also wants to end Medicare Advantage and create Medicare Choice. Although over a third of our senior citizens have Medicare Advantage, which is Medicare alternative plans, which tailor their plans based on the needs of the senior citizens and can often help reduce their out-of-pocket costs. And they just want to take that away. And then finally, Medicare Extra for All requires anyone who immigrates here and all newborns must be enrolled in Medicare Extra for All. So why would I, if I have a newborn, let's say I have a family of 4, my third child's coming, want my newborn to be in a completely different plan than me and my family that are my employer's work? I don't. Medicare Extra for All does is because their plan is to secretly eventually get everyone in Medicare Extra for All. If everyone that's born, anyone that comes into the country has to be in their plan, eventually as time goes by, everyone will be in their plan. Now all single payer systems have the same flaws. They all want to eliminate employer-sponsored health insurance. So the problem is as healthcare costs go up, and as the healthcare costs increase faster than inflation, the employer pays. The employer has to figure out how they're going to cover these costs. If you make this a single payer government plan, then the government has to figure out how to cover those costs. I mean, they can propose increased raising taxes every year, but that's not going to be very popular. So the thing is right now, why not let the employers bear the brunt of the cost? The other thing is private health insurance pays more than the government does. In fact, a lot of hospitals and other medical businesses will actually lose money on Medicare and Medicaid patients, but they make the money up on private health insurance. They call that cost averaging because their average income per patient is higher than their average cost per patient. But if they just have Medicare and Medicaid patients, they would lose money. Well, Medicare Extra wants everyone to use their system, but they're going to increase the rate the government's going to pay everybody to overcome that. So now they want to take over everything but increase the rate they're going to pay, which that kind of gets rid of the savings. Now, Medicare for All, both the recent plans I discussed, they want to drop all the rates down to the Medicare rates. The problem is the Center for Medicare Services Office of Actuary said that 80% of those hospitals would lose money. So now you've got options: increase rates, subsidize hospitals, then there's potential lawsuits. So if 80% of the hospitals are losing money, they can only do that for so long. So now you've either got to raise the rates, which there goes some of your savings, or you have to subsidize the hospitals. Either way, to me, it's two sides of the same coin. Either way, you have to pay out more money. Now, a slick politician might find some hospital subsidies and say, hey, look, we didn't increase the rates. I told you, the rates stay the same. Now, the other thing they didn't consider is lawsuits. Maybe the hospitals get together and say, hey, they created a monopoly, they eliminated the free market for us to bid on everything, and the judge sides with them in the lawsuit. And the judge helps the hospitals determine what the fair market value price for those services are that the government now has to pay for everybody. Once again, we're already trying to figure out how we're going to pay for these plans, and now the judge just says, hey, you're going to have to pay even more. Administrative costs. These plans argue Medicare has a 6% on average administrative costs, and private insurance on average has a 13% administrative costs. But that would lead to the conclusion that all these private insurance companies who have to answer to investors are whittling away billions of dollars of unnecessary administrative costs. The problem is, what people don't take into account is that the average senior citizen on Medicare spends a lot more per year than the average working age private insurance person. So the administrative costs as a percentage of total spending are lower, but not as an absolute cost. So I'll give you a couple examples. A healthy 30-year-old comes in, has an annual checkup, doctor gets some labs, maybe the total cost is $500. The lowest administrative fee the insurance company charges the employer is $250 just to keep the employee registered with all their information. So out of $750 for the year, the administrative costs are a whopping 33%, which is a little high. But I just did this for an illustration. Maybe you have a 26-year-old who has 100% coverage through the employer, but they just skip their annual PCP visit. They feel healthy, they don't even want to go in. Administrative fees, I put $250, could be any dollar amount. In fact, the administrative costs are going to be 100% for that employee because they don't spend any money anywhere else. However, now in Medicare, you have a senior citizen with hypertension, heart failure, COPD, diabetes. They have just one inpatient visit in the hospital all year long, just one, and it's not uncommon. They might have 2 or 3, and their total costs are $31,000 for the year. Administrative fees are $2,000, so their administrative costs are 6%. But what's really cheaper, $250 or $2,000? And finally, we always hear about how Europe has universal coverage. We need to be like European countries where everyone has universal coverage. However, most of these nations have a variety of public and private options. They have out-of-pocket spending. If everything's free, people stop making rational decisions. They just want it all. So I gave some examples of average out-of-pocket spending. In Germany and Japan, it's 16% of total healthcare expenses. In France, on average, 17% of total healthcare expenses come from out-of-pocket. Italy, out-of-pocket, 26% of total healthcare expenses. Canada, Australia, and Switzerland, 30, 31, and 36% out-of-pocket on average. The U.S. spends more per person, but our average out-of-pocket is only 15%. So if we want to be more like European countries and have universal coverage, it doesn't mean everyone needs to have everything for free. In fact, it could be very costly if everything's for free. So in conclusion, a single payer system will not cure most ills of the U.S. healthcare system. It may not cure any ills of the U.S. healthcare system. It only means we're throwing out the current system. And if it's a huge mistake, we may not be able to go back after eliminating private health insurance companies. If 5 years down the road, the costs are twice what we expect and our revenues are half what we anticipated, there just might not be anything to go back to. We may actually destroy the entire economy of our country. Not having a single payer system, here's the key, does not mean we cannot become more efficient or have universal health care. Those can be achieved. In fact, as I pointed out, most of the European countries have a combination of a public-private system. Now, we know what our major issues are. What we really need are politicians willing to stand up to the powerful lobbies of the healthcare industry to help us take care of those problems.